Any issues that you come in with particularly?
No.
No neck pain, no low back pain, none of that stuff?
Every once in a while, I'll
Yeah.
feel a little bit chest pain, a little bit of lower back pain.
Okay.
But that's just when I'm deadlifting, stuff like that.
So you'll feel tenderness during a deadlift?
Yeah.
Okay.
Yeah. After a deadlift.
Okay, cool. I'm gonna do a little bit of exam just to kind of look. We're gonna probe for stuff. Okay. So have a seat here, facing that way for me. Okay. Right here, without giving me much resistance, lift both arms and just hold them for me.
Like just straight up like that.
Out to the
Or
side,
to
and
the
then
side.
let me push down here. Okay. Now give me some good resistance. So. Okay, good. Any pain with that at all?
No.
Nope. Okay, good. You can relax there for me. All right. Any pain there at all?
No.
Nope. Any pain there at all?
No.
Nope. Any pain there at all?
No.
Nope. Let's have you stand here, face the mirror, put your hands on your hips. All right. And I want you to tell me if you notice any difference in hand placement on your pelvis.
This hand looks a little bit higher.
Looks a little bit higher, right?
Yeah.
Okay, that's what I'm looking at too. This is kind of how I analyze. When you put your hands on your hips and you're finding exactly where it's at, I'm looking at hip level here, okay? Another thing that I'm noticing is if you notice very slightly how one side's kind of rotated, okay? So you can relax your hands down to the side right here. Right there, I want you to touch your toes. Come back up. Any pain with that at all? No? Okay, good. Let me have you lay right there face up for me.
Face up.
Go all the way to the edge of the table. Cool. All right. Without bending your knees, lift both legs for me. Hold them right there. Don't let me push down here. Any pain with that?
No.
Nope. Lift it a little higher. Hold them right there. Don't let me push down. Any pain with that?
No.
Have you done some legs recently? You just did the other day, right?
Yeah, I did. Yeah.
Sore? So?
No, not too much. I didn't get too heavy.
Leg face down right there for me.
Face down.
All right. Cool. Good. All right. Okay. So remember you were saying that one hip looked a little bit higher than the other?
Yeah.
Okay. Just based on a quick assessment. I know we have shoes on, guys, so it's not really going to show a big time.
You want me to take off my shoes?
We can right here. All right. Okay, so we still have a little bit of imbalance here. Okay. Relax right there for me. All right. Cool. Okay. All right. Good. All right. You can relax there. So when I'm looking at foot length, right? Shoe on and shoe off. We saw there was a little bit of an imbalance, but we already saw that based on you standing and your hip level, right? Okay. Any pain when I'm doing any of this down here?
No.
No. Any pain here?
No.
No. Cool. Tenderness in here?
Yeah, a little
Yep.
bit.
Tenderness in here?
Yeah, a little
Now,
bit.
does that go up to your chest?
Oh, no.
No. What about here?
A little bit.
Okay. Here?
Yeah, a little bit.
Okay. Lay face up for me. So when you're telling me you have chest pain, what are you feeling on the chest?
It's like right in the middle, right where, like literally like dead center.
Okay.
I don't know. It's just like it feels like a sharp pain. It's just every once in a while. Like I
Okay.
just start breathing in really heavy,
Okay.
and it like makes it go away a little bit.
You
But
said during working out?
no, after my workout.
After working out.
Sometimes after my workouts, yeah.
Okay.
Like in that area.
You feel any tenderness here at all?
Yeah.
Is that the type of pain you feel?
Yeah.
Right there?
Not on that side, but on the other side, yeah.
Right in here?
Yeah, right there.
And that's what you feel when you feel that?
Yeah, a little
Okay.
bit.
All right. I'm going to help you up here. Okay. Cool. So we're talking about that because there's a few trigger points there, right? That are in the back. And when we have patients that are experiencing like the pain trigger points right here within the back, these trigger points are exacerbated here in the front as well.
That's what I was thinking about.
And it kind of feels like you can't really breathe in there. Like it's super tender and painful there.
That's
Kind
why
of like
I
when we're
breathe heavy.
pressing. Exactly, right. Now, another sign could be what's called angina, where you just kind of have pain right behind the chest area. But I'm not assuming that that's going to be the issue. Based on assumption, we'll kind of see how you progress after this, right? So we're going to use adjustments through the entire spine. As far as you do back, obviously, exercises, okay? So we want to continue and maintain back exercises to improve back strength, right? So today we're going to adjust you from top to bottom.
Okay.
As we were palpating, we already have some movement, a little bit of what we call audible or cavitation. That the adjustment is basically going to be so we can increase a segmental movement, okay? Segmental range of motion. When we do that, the body, we have our own little individual segments should move in 6 different ranges of motion. Each little segment has its own lymphatic drainage, so that means that to flush good fluid up and down the spine, we need good spinal mobility, good spinal motion. That's what we're going to do today, okay? What happens? Some of these symptoms that you experience during workouts or after workouts start to go away. Okay, so symptoms are just a sign of something going on that's not moving appropriately or functioning appropriately in the spine. We correct the spinal misalignments and we get improvement. Okay, so we're going to demonstrate adjustments today. All right, cool.